Hello, Namaste. I'm Dr. Sirish, one of the Hybrid International Emergency Medicine Training and Associate Member of Royal College of Emergency Medicine. This is a short video presentation in my Quality Improvement Project. And my topic for Quality Improvement Project is QSOFA as a predictor of sepsis in a suspected cases in emergency department. During my practice here, I have encountered a lot of cases in sepsis with a mortality and delay in 1 hour of bundle. So why sepsis? Sepsis is a huge global health problem and represents a great challenge regarding diagnosis and treatment for physicians. Sepsis is defined as life-threatening organ dysfunction due to dysregulated host response to infection. So organ dysfunction is characterized by acute increase in 2 or more SOFA score. A new score, QSOFA, is introduced in Sepsis Task Force. Even though QSOFA is widely used around the world in emergency department, but there is lack in use for prediction of sepsis in CMCTH. All patients who are evaluated on the basis of QSOFA don't give the exact picture of sepsis. Some patients develop sepsis with 2 or more score of QSOFA, which in turn delay the primary management. Doing this study will improve management and prediction of sepsis. Moving towards my persona. Hari Buddha, a 45 years old male, who is a known case of CKD, who is under regular dialysis with dialysis catheter in his situ, came to the emergency department with complaints of shortness of breath and disorientation. On his trials evaluation, his disoriented to time, place and person has a RR of 32 and a BP of 90/60 mm of Hg, pulse of 122, fever of 101 degree Fahrenheit with pus dripping down his dialysis catheter. The primary care of this person would be a nurse being beside the patient and checking his ABCDE along with a doctor, evaluating his mental status, joining him for a cardiac monitor and recognizing this is a suspected patient from a QSOFA criteria. A fast approach for his 1 hour protocol, which has been delivered by a health professional, and very fast approach to remove the foci of infection. This figure shows you the process map. This process map shows you a patient that arrives in the emergency department in the CMCTH. The first evaluation, as usual, is from the trials evaluation. The trials, if they complete the QSOFA criteria, if 2 is more than that, then she or he will inform the concerned health professional and they will start the 1 hour protocol. When you complete the 1 hour protocol, then we move towards the focused assessment. As you can see, the way things looks over here, it's very easy in the process map, but we can evaluate where we have the problems. As for identifying my stakeholders, who are the trial staffs, the doctors, the nurses on duty, to the adequate BP curve that has been used. I have indulged a lot in my sepsis cases this year. So I have done my audit in one part of the 1 hour bundle, that is timing to antibiotic in a suspected sepsis patient in CMCTH emergency department. My data, as I have collected, it shows that 75% of them have received the antibiotic within the 1 hour protocol. But the labeling of QSOFA, as for the QSOFA criteria, were done in only 25%. Coming towards my quality improvement project, that is my thesis. My thesis is a research which will give us a data on how many patients have been labeled as suspected sepsis and have received the 1 hour bundle. As I show you the process map, and this my Fishbone analysis will show us where we are lagging and give us idea about where we can improve in the specific section. Doing recurrent audit in different time frames will give us an idea about QSOFA and with quality assurance as well. I've taken a little review from a Surviving Sepsis Guideline 3, which was done in JAMA in 2016, which recommends us to use the QSOFA criteria in emergency departments. I will be taking the written consent in both Nepali and English language that will be available for patient party to read as well as the patient, along with the ethical clearance that I have taken from CMC IRC department. Every data that I will be taking as a thesis will be collected from the CMC emergency department and the software which we use in our department, that is Midas, and will be analyzed by IBM SPSS version 22, which is a software. All the data that will be published will be using the Square guideline. As you can see, this is also my grand chart, which is the progression that I will be doing in my second, third, and my fourth year as well. Thank you.